What is anion gap? So in body there should be electroneutrality, that is number of cations should be equal to the number of anions. In metabolic acidosis there is importance of calculating the anion gap. So anion gap is calculated by we subtract the value of sodium, take the value of sodium and subtract the value of bicarbonate plus chloride. So we add the value of bicarbonate and chloride and subtract it from the sodium, and what comes is the anion gap. So why there is an anion gap? It is because of unmeasured anions. So usually we do not measure some anions which is already in the body, like albumin, sulfate, phosphate, urates, formates. So these are in the lactate, ketoacetates. So these are in the body which we do not measure while calculating anion gap. So this unmeasured anions cause a gap called anion gap. The normal value of anion gap is 12 and it varies between +4 to -4, that is 8 to 16 may be within the normal limit. So in metabolic acidosis there may be normal anion gap, that is near to 12, or increased anion gap. When the anion gap is within the normal range, we call it normal anion gap metabolic acidosis, that is NAGMA. When this is high, anion gap is high, then we call it high anion gap metabolic acidosis, HAGMA. So there are different causes of HAGMA and NAGMA. Thank you very much. Pranam.